So today we will discuss ECG changes in acute myocardial infarction, the series of changes that takes place in the person with acute myocardial infarction. So this is the normal ECG, the positive waves and the negative waves. This is the normal ECG, the normal waves P, Q, R, S, T, and in some person we can also have a small positive wave after the T wave, which is the U wave. So the changes. So the first change in acute MI is increase in amplitude of T wave. So the first change is the increase in amplitude of T wave. This is the first change. There is increase in amplitude of T wave. It is also called peaking T wave. This is the first change, and this change takes place within minutes after myocardial infarction. Then the second change. The second change is ST segment elevation. There would be elevation of the ST segment. ST segment elevation. This is the second change in myocardial infarction that takes place around 2 to 4 hours after myocardial infarction. Then the third change. Third change is the T wave depression. T wave depression. It is also called inversion of T wave. Inversion of T wave, which is the third change that takes place around 8 to 12 hours after acute myocardial infarction. And after 1 to 2 days, there is development of a deep Q wave. There is development of a deep Q wave, a large visible Q wave. This is the fourth change. It is also called pathological Q wave. Usually Q waves are not visible in ECG, but there would be a prominent Q wave which will be around 2 small columns, and this takes place around 1 to 2 days after an attack of acute myocardial infarction. So the first change is increase in amplitude of T wave that takes place within minutes, in few minutes. And the second change is ST segment elevation. It takes around 2 to 4 hours for the elevation of ST segment. Then the third change is inversion of T wave that takes around 8 to 12 hours after myocardial infarction. Then the Q wave, which developed after within 1 to 2 days of a attack of acute myocardial infarction.